With Verapamil, I'm able to live a life with less pain. Verapamil helps control my angina, meaning that angina pain will no longer get in the way of me living my life. Thanks, Verapamil.
With Verapamil, I can maintain my active lifestyle without fear of high heart rate or blood pressure.
Verapamil means atrial fibrillation doesn't have to control my life.
Verapamil helps keep my heart healthy so I can continue to do the things I love, like spending time with my chickens. Before taking Verapamil, I had uncontrollable high blood pressure, and I knew that was dangerous. But taking 80 milligrams of Verapamil 3 times a day helps keep my blood pressure in check so I can continue to do the things that I love. Some common side effects are dizziness, headaches, constipation, and orthostatic hypertension. Thanks, Verapamil.
Hi, Brandon. How are you today?
I'm doing well, thanks. How are you doing?
I'm well. Thank you for asking. My name is Morgan, and I'm a nurse here at the Good Heart Clinic. And I understand that your doctor has prescribed you a new medication that you have some questions about.
Yeah, Dr. Goodhart prescribed me something called Callan. I don't know. She told me a little bit about it, but I'm afraid to take it right now, so I just wanted to get some clarification about the med.
So Callan is the brand name for a medication called Verapamil. And oftentimes it is prescribed for high blood pressure, high heart rate, some cardiac dysrhythmias like atrial fibrillation. And then it's also used for people experiencing chronic chest pain, otherwise known as angina.
Yeah, that's what I went in there for.
Sounds like it. Do you have the prescription with you?
Yeah, here. Let me grab it here. You have it with me.
Okay, so looking at the medication administration record, it looks like she prescribed you 180 milligrams of Verapamil sustained release and instructed you to take 1 by mouth daily. Does that look right on your prescription bottle?
It's like it says Callan CSR? SR.
Yeah, so the SR stands for sustained release.
Okay.
So basically what that means is that medication will be released slowly. And that's why we're able to prescribe that once a day instead of a medication that doesn't last quite as long, that's released more quickly and you would take twice daily. With a sustained release medication, though, it is very important that you swallow it whole and do not chew or crush that medication. Just in the way that it works, it needs to be intact when it starts going through your system.
Okay.
Have you started taking it yet?
No, I wanted to talk with somebody about it first before I started taking it.
Sure. So let's talk about some of the things I want you to be aware of. So with Verapamil, because it can lower your heart rate and blood pressure, we do like our patients to check those things before you actually take it. So if you notice that your heart rate is below 60 beats per minute, or if your blood pressure is low, like 90/60 would be a reading we would consider low, hold the medication and give Dr. Goodhart a call, okay? It's also important that you take this medication in the morning with food. And some of the things that this can interact with is alcohol and grapefruit juice. So you'll want to avoid taking the medication with grapefruit juice, and we do recommend avoiding alcohol as well.
Okay.
For the first week or so, we want to see how you're going to tolerate this medication. And so we recommend avoiding any activities that require increased concentration. Verapamil can cause fatigue and dizziness. So on that note, another thing that I recommend is anytime you're going to be changing position from sitting to standing, make sure you do so slowly and take nice controlled deep breaths while you do that.
Okay.
Does that okay?
That sounds okay. There's no brunches for me with grapefruit mimosas.
Yep. And then one last thing that we can see with Verapamil is it can occasionally, for some patients, cause constipation. So just making sure you've got adequate water intake, and if you can add a fiber supplement or make sure you're consuming fiber-rich foods, that can really help prevent that problem.
Oh, okay. So I should eat more salads. Everyone tells me that.
Yeah.